Did you know that eating disorders put you at a high risk for medical conditions, including cardiac arrest? Let's dig into some of the reasons why eating disorder behaviors such as purging, laxative abuse, and malnutrition put you at a greater risk of medical complications like cardiac arrest. My name's Shena, and I'm a registered dietitian that's been specializing in the care of persons with eating disorders. So the risk of heart attacks is prevalent in every eating disorder, but it is especially prevalent in people that have purging behaviors such as self-induced vomiting or laxative abuse. And the reason why is that these individuals are experiencing often really extreme electrolyte shifts. So things like low potassium or sometimes high potassium, low sodium, low magnesium, and sometimes low calcium. And all of these have a really dramatic impact on the heart in multiple ways. So the really risky thing about something like purging or laxative abuse is those things shift very quickly. And so this can have a very immediate response and put you into cardiac arrest even if you haven't been engaging in these behaviors for very long. So this is why it's so important that you seek help as soon as possible as you're noticing these behaviors and work with a qualified medical staff in your eating disorder recovery. These low electrolytes can cause things like slow heart rate, which is known as bradycardia, or even rapid heart rate, which is known as tachycardia. But the main thing is there is often irregular heartbeats, which can lead to greater heart damage and, like I said, other potentially life-threatening complications. In addition, malnutrition has a dramatic impact on the structure of the heart. So we'll often see things like reduced left ventricular mass called an elongated QTc interval, which can be associated both with muscle deterioration and low calcium and other electrolyte imbalances. Many times if we are engaging in very low calorie intake as well as purging behaviors, we're often also experiencing dehydration, which reduces the blood volume and can put strain on the heart. So these are some of the very immediate and very dangerous risks that are associated with some of these eating disorder behaviors in bulimia. Also might experience things like chest pain, which should always be investigated by a medical professional, but could be related to things as well, such as panic attacks from stress and anxiety, which is often heavily correlated with eating disorders, or you might be experiencing agitation in your esophagus from the repeated vomiting, and we can even have bleeding, other medical complications. A qualified medical professional can help you to reduce the risk of some of these things as you are working through recovery. With malnutrition, all of our muscles are starting to deteriorate because we just don't have enough nutrition to support maintenance and growth. And that actually, unfortunately, includes the heart muscle as well. Our body's going to do what it can to preserve the integrity of the heart because it knows that it is a vital organ in the body. But it often is going to slow the heart rate and lower the blood pressure in order to preserve the energy that is necessary for the survival of your body. The only way to completely eradicate the risk of heart attack and other medical complications from bulimia nervosa is to eradicate all eating disorder behaviors and work with your healthcare team to properly weight restore, including any overshoot weight, which might be necessary for organ and tissue repair. If you found this video helpful, please consider subscribing and like and share it with a friend.